a neat approach to weight loss. And this is a brief synopsis of the talk today. We'll talk firstly about defining the unhealthy weight epidemic as it exists in our country. I think a lot of us as clinicians are very familiar with this. We see this in our patient population. We'll go over some definitions of what we mean by exercise, non-exercise activity, physical activity, and hopefully I can clarify that. We'll talk about the role of NEAT in weight loss, some clinical studies involving NEAT, and then how do we as clinicians incorporate NEAT into a weight loss program for our patients. And then we'll conclude with some final remarks. So to begin with, overweight and obesity are responsible for over 300,000 deaths a year in this country. It is a problem, and it's getting worse and worse. And this is probably a more conservative estimate. This is from the year 2000. It's considered second only to smoking for deaths due to lifestyle modification. And if you look at even more recent studies, it may have already surpassed smoking as the #1 preventive killer in this country. 64% of adults are overweight or obese, and if you look at the latest NHANES data, 2003, 2004, this number is not improving, it's increasing. For pediatric and adolescent population, it's actually tapering off, it seems, but it keeps growing for the adult population. It's not going anywhere, and we need to address it. This has tripled over the last 30 years, if you look at data from the 1970s to 2000. And we've also seen an increase in significant adolescent and childhood obesity, and I'd also like to mention that we see a parallel increase in obesity-related comorbidities and conditions. So, for example, pediatric diabetes, which used to be 0.5% incidence in the 1970s, is now about 1.5% incidence in 2000. So we see a tripling of pediatric diabetes, along with a number of other traditionally adult diseases, which we see more commonly in kids, like sleep apnea, hypertension, metabolic syndrome. It's a scary trend. Obesity is an epidemic in this country. It's not going anywhere. It's a problem, and it's not just an epidemic, but it's a pandemic. It's affecting many countries besides just ours. And the UK, Canada, Australia are close behind us. The US, of course, is #1 in this. But also traditional urban areas in East Africa and South Asia, where you traditionally think of as having slim individuals, but in urban areas they're seeing problems with the obesity epidemic. In fact, a few years ago, the host country for the International Obesity Association was Malaysia and Kuala Lumpur, and they also recognize the importance of attacking and addressing this disease. All right, so we're going to talk about non-exercise activity thermogenesis in this talk, and I want to just start by clarifying some definitions. What is physical activity? What is exercise? What is non-exercise activity? So basically, physical activity can be defined as any bodily movement produced by skeletal muscle resulting in energy expenditure. Okay, so anytime you move, anytime you walk, anytime you speak, anytime you mow the lawn, run laps, play basketball, that's physical activity. It's a blanket term. It incorporates everything. And it's skeletal muscle and it's calorie burn, basically. Burning calories, creating ATP, utilizing those, and contracting skeletal muscle. Now, the heart pumping blood through our body, that's not physical activity because that's not skeletal muscle. That's cardiac myocytes. The GI tract peristalsing food through our body, and we had a long discussion about that earlier today, that's not physical activity. That's smooth muscle, so it's not skeletal muscle, so it's not described as physical activity. But again, physical activity is this blanket term. It involves skeletal muscle and energy expenditure. So exercise is a subtype of physical activity that is planned or structured. It involves repetitive bodily movement aimed to improve physical fitness. The three main components of physical fitness are cardiovascular endurance, muscle strength, and flexibility. So it's planned, it's structured, it's volitional. If somebody goes to the gym and they run 2 miles on the treadmill, the reason for going to the gym and running on the treadmill was to improve cardiovascular endurance, because the person didn't go. The purpose of being on a treadmill is not to get from point A to point B, because you end up at the same place. So that was exercise. It was volitional. The individual intended to do it. It was repetitive, running on a treadmill. And again, the intention was not to create other value. It was simply to improve cardiovascular fitness. Similarly to somebody who goes to the gym and starts lifting weights. The purpose of lifting that weight is not because the weight needs to go from here to there, put on a shelf or something like that. It's simply to improve muscle mass. So again, that is exercise. It's volitional, it's repetitive, it's structured. So non-exercise activity is basically everything else. It's physical activity involving non-volitional exercise. So every other type of physical activity can be described as non-exercise activity. So what does that include? That includes such things as lifestyle activity. walking, going for a stroll in the park, gardening, bowling, fishing. Occupational activity, just like delivering the mail, moving furnitures, etc. Household activity, house cleaning, doing the dishes, doing the laundry, things of that sort. And that's a huge, I think, area underdeveloped in the treatment of obesity and weight management in general in my field, and we'll talk a little bit more about that. And of course, it leads to non-exercise activity thermogenesis, which is basically calorie burn from non-exercise activity. All right, before we engage this discussion any further, I want to clarify the energy balance equation. And this is very important in understanding calorie burn and obesity management in general. Now, I focus almost 100% of my clinical practice on obesity management, metabolic syndrome, and diabetes. Total daily energy expenditure, or TDEE, is equal to the basal metabolic rate, BMR, plus the thermogenic effect of food, TEF, or postprandial thermogenesis, it's also called, plus physical activity. And if you look at the equation, approximately 70% of your daily calorie burn in the average person comes from the basal metabolic rate. This is from your body keeping your core temperature, your heart pumping blood through your vessels, breathing, etc. 10% approximately comes from the thermogenic effect of food, which is the amount of calories you burn by digesting nutrients. Now, there are different ways to modify this in your diet. If you increase quality protein in your diet, you can actually increase postprandial thermogenesis, which leads to additional calorie burn. Other supplements such as EGCG, epigallocatechin gallate, has shown some potential improvement in the basal metabolic rate as well as the thermogenic effect of food. But that's approximately 5 to 10% of total calorie burn in your average individual. Physical activity accounts for about 20% of that total calorie burn in your average person. And it's interesting to note that in this category of physical activity, I don't have a pointer, but 75% of that comes from NEAT activity, and only 25% of that comes from volitional exercise. In fact, just to digress for a moment, there have been studies shown done on the geriatric population, which were weight loss studies where individuals who were put through an exercise regimen ended up not losing weight and actually burning fewer calories throughout the day, because what would happen is when they would go to the gym for about an hour a day, they would come home and they would rest longer, they would lounge around more, and they would watch more TV, feeling almost as if your exercise quota is finished for the day, and therefore compromising your NEAT activity, which was an intriguing study.